This video is for Mersey Care healthcare workers who require respiratory protective equipment, who have not yet been fit test trained in the use of FFP3 masks and are dealing with respiratory pathogens spread by an airborne route. We will show you the type of PPE required and how to put it on and take it off safely. This video covers how to put on PPE correctly, how to remove PPE correctly and safely, including safe disposal of PPE to avoid cross-contamination to the healthcare worker and the environment, and the decontamination process. Please refer to the Powered Hood's standard operating procedure. This SOP is available on Your Space, Clinical, Infection Prevention and Control, SOPs. This donning and doffing guidance is specific to Powered Hoods. Healthcare workers must be familiar with the Mersey Care operational arrangements for the safe care of patients with possible respiratory pathogens. Healthcare workers need to identify areas for safe donning and doffing of PPE. Safe systems of working, including the correct use of PPE, will help protect you and others against infection. The recommended PPE components are gown, alcohol hand rub, gloves in the correct sizes, respiratory protection, power pack with hose attached, belt, hood. Here are the recommended PPE components in more detail. A long rear fastening, fluid resistant long sleeve gown in the correct size. A respiratory hood, power pack, hose and belt and gloves in the correct size. Check the hoses inserted into the power pack and check the hoses inserted into the hood connection. Donning PPE, ensure you have an appropriate room with bench space, such as a treatment room. Pre-donning instructions. Ensure healthcare worker is hydrated. Tie hair back. Bare below elbows. Sew. No stoned rings, watches, bracelets. Check PPE is in the correct size and available. Use the belts to strap the VersaFlow power pack around your waist. Connect the breathing tube to the hood. Turn on power pack, press blue button, holding hood, lift the hose over your shoulder, ensure the hose does not become looped or tangled, don the head top, ensure the hood is fixed under the chin. Put on the long, rear fastening, fluid resistant and long sleeve disposable gown. Fasten the necktie and waist ties. Put on gloves. Ensure the gloves cover the cuffs of the gown completely. final PPE item fit check. Make sure the gown ties at the waist and neck and they're secure. The respirator is correctly fitted. The gloves cover the cuffs. You are now ready to enter the patient area. Doffing PPE. Ensure you have an appropriate room with bench space, such as a treatment room. The correct order for removal and disposal of PPE. Removing PPE step 1. To safely remove the gloves, the healthcare worker will grasp the outside of the glove with the opposite gloved hand. Peel off. Hold the removed glove and gloved hand. Now, slide the fingers of ungloved hand under the remaining glove at the wrist. Then peel the remaining glove off over the first glove and dispose of the gloves in the orange waste bag. Remember, the outside of the gloves are contaminated. To safely remove the gown, the healthcare worker will undo slowly and carefully, undo the necktie, undo the waist tie, pull the gown away from neck and shoulders, touching the inside of the gown only using a peeling motion, as the outside of the gown will be contaminated. Dispose of orange waste bag. Removing PPE step 3, which is outside the contaminated area. Turn off the power pack. Press and hold the blue button for 2 seconds. Disconnect breathing tube from the hood. Hold the front of the hood to ensure it remains in place. Remove top of hood. Pull the front of the hood directly away from your face and remove. Unclip the belt to remove the belt and power pack from around your waist. The hood should only be reused by the same person. If not being used again by the same person, the hood should be disposed of. Hoods are for individual use, decontaminate after each use, dispose of after an episode of care into the clinical waste, contact clinical skills team to arrange fit testing for an FFP3 respirator mask. The clinical skills team at merseycare.nhs.uk. Decontamination process. Ensure you have an appropriate room with bench space, such as a treatment room. The decontamination process is to be completed by the wearer after each use. Staff to wear disposable gloves and aprons prior to the decontamination process. Disconnect the hose, hood and belt for proper decontamination. Using a new canal wipe for each stage of cleaning for a 1-minute contact time. Step 1. Clean the outside of the belt, power pack unit and hose. Remember to use an individual wipe and dispose of the wipe after every use. Remove the battery and wipe the battery, making sure to avoid the battery contacts. Hoods should only be reused by the same healthcare worker. They should never be shared. If the healthcare worker is no longer required to use the hood should be disposed of in the clinical waste stream. If the hood is used again for the next episode of care by the same healthcare worker, decontaminate the hood. Use a fresh wipe to clean the inner portion of the hood and use a fresh wipe for the outer portion of the hood, making sure all the creases are covered. Then put it aside to dry, ready for next use. Remember to use the Clinell wipe. Do not use alcohol-based products on this area as it will result in permanent misting of the plastic. Remove and dispose of PPE in the clinical waste stream and perform hand hygiene with soap and water. At all stages of the decontamination process, ensure that you visually check for signs of damage or soiling. If damage is identified, continue cleaning and remove from use. Report to Eddie Whelan.